policies or what are you putting boots on the ground at the hospital to help empower employees?
When you look at empowering your employees, one of, I think, two changes in our culture that were significant in empowering employees. The first was when Jack first came, we started a journey of service excellence. And in that journey, really putting the patient first and putting our employees front and center. By rounding on them as leaders, asking them what we can do to help them in their job and giving them that voice and being able to tell us what's going on, what's not going on. That culture evolved, and we've implemented several years ago lean principles. And one of the tenets of lean is to really turn it over to those who do the work. You know, who knows their job better, the person doing it or the CEO? The person doing it, right? I may have never done their job. You don't want me doing a lot of the jobs we have in our organization. I don't think anybody wants to line up for me to stick them with a needle and draw blood. They know their job better than anybody. They also know where the inefficiencies and the waste are. And so by adopting those lean principles and empowering our employees to identify those issues, work with their team and their leadership to come up with solutions to those problems has been a tremendous change in our culture in empowering our employees and letting them answer their own questions versus us as leaders trying to have all the answers or pretend we have all the answers when we don't. So those have been very successful ways. I'll tell you another way that has empowered our employees. Every day, 7 days a week, because a hospital is a 7-day operation, not a 5-day-a-week operation, every day we have a patient safety call at 10 o'clock. So every day at 10 o'clock, staff get on the phone and they talk about any potential issue that might cause or impact patient safety over the past 24 hours or the next 24 hours. Absolutely non-punitive, and they're free to bring up anything they see that might get in the way of patient safety, and we address it immediately. And I think by putting those types of initiatives in place in your culture really allows employees to be comfortable being empowered. Now, innovation, I believe, is our next cultural transformation. And I believe there are a lot of different approaches to innovation in our organization. So when you think about innovation, I think about it in 3 buckets for our organization and our business. I absolutely believe we need to move in the direction of having an innovative culture. What does that mean? Well, from one perspective, it means capturing more of the healthcare dollar. You know, historically, we have focused only on the 4 walls of the hospital as our business. But when Wall Street defines the healthcare industry, it is a lot broader than just hospitals. And so coming up with solutions and ideas and business opportunities to meet our customers' needs and capturing more of the healthcare dollar because we're going to be squeezed on one side, why not? I'll give you an example. Prescriptions. So we have, on average, about 650 people in our beds every day. Most of them leave with a prescription of some type. There's a higher likelihood of them getting that prescription filled and being compliant if we use our outpatient pharmacy and take it upstairs to them, give them that first dose of medication. We can do it cheaper. They can buy it right there. We'll deliver it to them, and they'll have it to go home instead of having to worry about stopping at the pharmacy on the way home. It's great customer service, but it's also more of the healthcare dollar that we've seeded. Second way I look at innovation for our organization and our industry is really a way to advance our transformation. We know healthcare has to change. We know we have to change as an organization. So do we wait to be disrupted, or do we disrupt ourselves? And, you know, an example there would be artificial intelligence. Now, you're probably thinking, what does artificial intelligence have to do with the hospital? Well, historically, in the laboratory, okay, microbiology, you would have to get a specimen, you put it on a little plate, you put it in an incubator, you let it grow for so many days, The pathologist has to look at that, let it grow a little more, look at it again, and several days later, you know if it was or wasn't something to be concerned about. We have now implemented, just recently, an automated system in the laboratory that in hours does the exact same thing with zero human intervention, other than placing the specimen on the machine. Other than that, it does everything, as including read that specimen and using artificial intelligence to really disrupt ourselves and improve patient care. The last aspect is one I think you were getting at, which is the cultural piece of innovation. As leaders, we need to make it safe for our staff to try new and different things. That's what innovation is about, is trying new and creative solutions, trying something different, not the status quo. With that, as I don't have to tell entrepreneurs, one in how many of those ideas actually work out. So we have to recognize that not all those ideas are going to be a success. And if our staff fail, we can't make that a negative. We have to work with them to learn from that failure, that mistake, and then transform that into the next iteration of that solution. And so we're looking at putting together an innovation center for our organization to accomplish all three of those aspects and really start to move our organization in that direction. Now, that doesn't mean we're all going to be entrepreneurs and innovators, but if we get that mindset of creativity, not being afraid to do new things, really being able to have the cycle times a lot quicker than, hey, let's put a committee together and have 18 meetings to solve that. Which is the typical culture in a hospital or in a large organization, and moving those iterative cycles quicker is what we're after.
Is that a physical center at the hospital, or is that a council that meets? What is that going to be?
Yes.
Both?
So first and foremost, we do need a physical space. I absolutely believe it should not be on any of our campuses, because I believe if we're going to truly innovate and disrupt ourselves, we have to get outside of our own four walls. We have to get outside of our own mentality. And quite honestly, most of us grew up in the hospital and healthcare business. It might need to be somebody that doesn't even have a healthcare background. So I think it's a physical space where we can have some dedicated staff, that this is their full-time role. But then I also believe that we have to take that and connect it back to our organization in all three of those ways, in new products, in disruptive approaches, as well as culturally. How do we then cascade some of that mindset throughout our organization and educate our staff? So I think it has to be a comprehensive approach, both virtual and physical.